Hey there friends, Rachel here from MindMomBodyRN, and today we're taking a deep dive into a topic that's essential for every woman to know about, birth control methods. So let's break it down together. Our first stop is barrier methods. Condoms. Those trusty protectors come in latex or polyurethane. They're like a shield blocking sperm from reaching the uterus. Their effectiveness varies with a typical 13% failure rate. Just a heads up, some may have latex allergies, so consider that. Moving on to hormonal methods. Combined oral contraceptives, COCs, are like a well-choreographed dance of synthetic hormones. They prevent ovulation, thicken mucus, and thin the uterine lining. Their typical failure rate is around 7%. But hey, if you have a history of blood clots, certain cancers, liver disease, or high blood pressure, it's like a pause on this one. Progesterone-only pills, otherwise known as POPs, are like mini solo performances. They thicken mucus and halt ovulation. With a 9% typical failure rate, they're decent backup dancers. Again, keep an eye out for blood clot history and such. Injectable contraceptives, those 12 to 13-week superheroes, stop ovulation and thicken mucus. They're pretty effective with a 4% typical failure rate, but same deal. Blood clots, certain cancers, and liver disease can throw a wrench in that plan. Hormonal implants are like the backstage VIP passes. They're inserted under your arm and release progesterone to stop ovulation and thicken mucus. At less than a 1% typical failure rate, they're practically rock stars. But yep, you guessed it, blood clots, cancer history, and liver issues are showstoppers. Let's talk about IUDs, or intrauterine devices. The copper IUD is like a toxic party for sperm and eggs, releasing copper ions and preventing fertilization. It is super effective with less than a 1% typical failure rate. But hold up, if you have any pelvic inflammation, certain cancers, or a wacky uterus shape, it's a no-go. Hormonal IUDs, on the other hand, release progesterone to stop ovulation and thicken mucus. With a similar less than 1% typical failure rate, they're like secret agents of contraception, and yes, those contraindications from earlier, still in play here. And finally, the permanent methods. Tubal ligation is like a grand finale, sealing those fallopian tubes like VIP access denied. Less than 1% typical failure rate, and just remember, pregnancy, some medical conditions, and surgical risks are the velvet ropes here. Vasectomy, the male counterpart, cuts off the sperm's journey like a closed sign. Also less than a 1% typical failure rate, and again, infections, certain conditions, and surgical risks are the bouncers. Keep in mind, the effectiveness rates account for everyday slip-ups. When done right, these methods can be superheroes of birth control. But before you make any decisions, have a chat with a healthcare pro. They'll help you find the perfect method for your unique situation. That's a wrap for today's breakdown on birth control options. If you have any other questions about birth control options or women's health in general, drop your questions in the comments below. If you found this information helpful, don't forget to subscribe and hit that notification bell. Until next time, take care, mama.